Child development stages. It is normal for babies to move their legs and arms frequently, as they are developing their motor skills and exploring their bodies. This movement, called kick and wave, is a sign of healthy development and is usually nothing to be concerned about. However, if you have any concerns about your baby's movements or overall health, it is best to consult with your pediatrician. Table of milestones. There are several milestones that babies typically reach in regards to kicking their legs and moving their arms. These milestones include: birth to 1 month, the baby will begin to flex their arms and legs, but they will not have much control over their movements. 2 months, the baby will begin to kick their legs and move their arms more frequently and with greater force. They may also begin to reach for and grasp objects. 4 months, the baby will begin to roll over, scoot, and crawl, using their arms and legs to propel themselves. 6 to 9 months, the baby will begin to sit up, pull themselves up to a standing position, and may take their first steps with assistance. 12 to 18 months, the baby will become more coordinated in their movements and will begin to walk independently. They will also begin to use their hands more skillfully to explore and manipulate their environment. It is important to note that every child is different and may reach these milestones at different times. If you have any concerns about your child's development, it is best to consult with a pediatrician. Physical development. The constant kicking of legs and moving of arms in a baby is a sign of normal physical development. These movements are known as reflexes and are controlled by the baby's central nervous system. They help to develop the baby's motor skills and prepare them for crawling, walking, and other physical milestones. As the baby grows, these reflexes will become less pronounced and will eventually disappear. It's important to note that every child develops at their own pace and there may be variations in the timing and intensity of reflexes. Consult with a pediatrician if you have any concerns about your baby's development. Motor development. It is normal for babies to constantly move their legs and arms as they are developing their motor skills. This type of movement is called reflexive movement and helps babies learn to control their limbs and develop coordination. As babies grow, they will begin to develop more purposeful movements and eventually be able to sit, crawl, and walk. It's important to provide opportunities for babies to practice their motor skills and encourage their movement, such as placing toys out of reach to encourage crawling or providing a safe space for them to practice standing and walking. Communication skills. A baby constantly kicking their legs and moving their arms is a normal development stage. This movement is a sign of their growing motor skills and coordination. Communication skills are not directly related to this physical movement, but rather develop as the baby begins to understand and use language. These skills typically develop over time, starting with cooing and babbling, and eventually leading to the use of words and sentences. 1 month old. It is normal for a 1-month-old baby to constantly move their legs and arms. This is because they are developing their motor skills and exploring their body. It is also a sign that they are healthy and active. However, if you have any concerns or the baby's movements seem unusual, it is always best to consult with a pediatrician. 2 months old. It is normal for a 2-month-old baby to be constantly kicking their legs and moving their arms. This is a sign of healthy physical development as they are learning to control their movements and gain strength in their limbs. However, if you have any concerns, it is always best to consult with a pediatrician for proper evaluation. 3 months old. At 3 months old, it is normal for babies to be constantly kicking their legs and moving their arms as they begin to develop their motor skills. This is known as the Moore reflex, which is a startle response that infants have to sudden movements or loud noises. As they grow and develop, babies will begin to have more control over their movements, and their kicking and arm movements will become more intentional. 4 months old. At 4 months old, a baby's physical development typically includes the ability to kick their legs and move their arms. This is a sign of healthy muscle development and coordination. It is also common for babies this age to begin reaching for and grasping objects with their hands. This is all a normal development milestone for a 4-month-old baby. 6 to 12 months. Between 6 and 12 months of age, infants typically begin to develop their gross motor skills, which involve the use of their large muscles for movement. This can include kicking their legs and moving their arms. This is a normal part of physical development for infants at this age. However, if you have any concerns about your baby's development, it is always best to consult with your pediatrician. 12 to 24 months. Between 12 and 24 months, babies typically begin to develop more control over their movements and become more active. They may start kicking their legs and moving their arms with purpose, as they learn to crawl, pull themselves up to stand, and take their first steps. This is an important stage of physical development, as it lays the foundation for more advanced gross motor skills. Encourage your baby to explore and move through supervised play, and consider consulting with your pediatrician if you have any concerns about your child's physical development. 2 to 8 years old. During the 2 to 8 year age range, children undergo significant physical development. Constant kicking of legs and moving of arms can be a sign of healthy physical activity and development. It may be related to the child's exploration of their body and the environment around them. However, it is always best to consult with a pediatrician if there are any concerns about a child's development. They can assist the child's growth and development and provide guidance and recommendations if necessary. Summary. It is normal for babies to move their legs and arms frequently, as they are developing their motor skills and learning to control their movements. This activity is a sign of a healthy, active baby. However, if a baby's movements become excessive or concerning in any way, it is always best to consult with a pediatrician.